Emotionally, it was very, very traumatizing. Mentally, yes, because you're so educated, you have a clinical setup, you're doing so well. People who are probably on the same track with you are doing well, and you're not able to. So, that kind of a comparative mindset also has emotional trauma. A lot of people who have no idea of how to start up a clinic put together. I think everything that we did went wrong and backfired. Being a doctor is no such easy task. We had 5 years of complete breakdown mentally. Only then you become a doctor. When dentists go door by door scanning teeth, I think that day has come.
So, what were your thoughts once your clinic was disposed? Was it traumatizing? So, what emotions did you underwent?
It definitely was, because I think for around 3 to 4 months, me or my partner, we would not get sleep thinking about how are we going to pay the next month rent. So because we couldn't pull in so much of money, and every time backing up for my parents or seeing somebody, expecting somebody to pay the rent, it was quite traumatizing. Emotionally, yes, because you cannot, they have put in so much of effort in making you a doctor, educating you, doing so much, and again you cannot go back to them and ask them for financial funds. Emotionally, it was very, very traumatizing. Mentally, yes, because you're so educated, you have a clinical setup, you're doing so well. People who are probably on the same track with you are doing well, and you're not able to. So that kind of a comparative mindset also has emotional trauma. A lot of things, definitely financially it was traumatizing to the core, because I'm sure by the time we started it, people were enjoying, who had taken engineering parallel to me, were enjoying their life, and we were resolving something that was so not our forte. Because being doctors, we put in so much of efforts into everything, and to see something that was so passionate, we were both were about, and so close to our hearts, because our first clinic, or your own clinic, is like your baby. So we gave in everything, and see it dissolve right in front of you, not able to pay the basics. It was really traumatizing.
So, for how long did you run the clinic?
Yeah, my clinic was on for 1.5 years.
So, how did you dispose your equipments?
Yes, definitely I would want to answer this, because many people don't know where to dispose their clinics. So what happens is, when you procure a dental chair, you end up from a very basic model. I would start. It starts from 3 lakhs to around 7 lakhs. So what happens is, we go for a very basic model also, say 3 lakhs chair, but by the time, if it's a year old, the prices go to 50k. So if you're getting a decent price of 20k to 50k, I would advise you to please sell your dental chair if you want to, per se. Because if you're waiting for a good price, then you'll have to hold this place, and you have to pay the rent extra, and there's no better price than that for a dental chair. If you are, the other person is not aware of the standard market rates. That's how lucky you have to be. The person is even a little aware of how the other market rates are, definitely the clinic will go for a toss. And your interior setups, your interiors, we had huge interior setup, because my space was huge, and even to take them, dispose them, transport them from my place to a godown or a dump yard where I knew, a place of my own, yet the transport charges were so huge, because the furnitures were so heavy end. And medicines, when the pharmacy, we all knew, we being dentists have no experience of running a pharmacy. Though they were pharmacists, they were also little freshers, and they didn't know much about how to handle it. So all of this was gone to medical waste. So actually they were been through. So, yes, even when they had expiries, they were given to the biomedical waste people, and those which didn't have expiries were like, they were in continuation, they were not expired by then, they were given back to the dealers, but the prices are not settled even till date.
How long did it take to dispose your equipments?
We took around one and a half month to dispose. And this dispose, also we had to pay our rent. Yes, when we were disposing the clinic, there were a lot of people who came in. There were a lot of offers when we were disposing the clinic, which actually said they wanted to take up this clinic as a franchisee, where we would just handle their names and their interiors, and we have to give them some money, and they would give us marketing. There were a lot of strategies that came up. That's when I knew that if I had known even 10% of what I knew now, when I'm ready to dispose, when I started a clinic, I think I would have made a better clinic. But there were a lot of things, marketing strategies that exist, which I think you should do a lot of survey, and you should know what is best for you and take up when you are actually planning to take up a clinic.
So, what's your perspective being a dentist in Indian society? Can you please elaborate on that?
I think every child wants to be a doctor in some point of their life. Okay, every child as they grow up, when they see a doctor, they definitely get inspired to become one. And being a doctor, I know a bunch of people who also aspire this for a very long time and make it a dream come true. And those bunch of people are what are we doctors. So it's a dream that we pursued it since we were kids. We've been to a doctor or a dentist, we've seen them work, we wanted to be them, we wanted to replicate them, we wrote prescriptions at home, we grew up and we sacrificed a lot when we were growing up. I know my fellow counterparts, when they were watching a movie, I would take up a book because I wanted to be a doctor. I wanted to be very studious. I would sit down, be a nerd, call terms like those, and sit down, study for hours together, cracked my NEET, cracked my CT back then, scored excellent marks, did so much of efforts, put in everything, become a doctor. And once I wore a white coat, the journey wasn't that easy either. It was very difficult. We had to do a lot of grilling that happened eventually. Being a doctor is no such easy task. We had 5 years of complete breakdown mentally. Only then you become a doctor. The amount of pressure every dentist or a doctor goes through, only that person knows, because apart from huge academic career, you don't have much of friend circle because everybody is studying. You don't have a me time or a fun time. Whatever little fun we have, that is the me time that we have in the entire dentistry or being a doctor scenario, whatever it is. So all of that we come through, and then our external grills us, our internal grills us, be it viva, be it exams, be it for patient hunting. For a dentist, we've been literally hunting patients because we have always seen this scenario where we don't have patients. Our college doesn't provide us much of patients. Lucky enough for few colleges, but mostly we don't when you're in a private setup. And then we literally have to go beg people, pull them down, become so humble that even if somebody becomes very rude to you, I think it's fine, because we've grown into that phase that we've seen so much of rejection at every point in our growing years, where people actually hold up their ego. We've seen people rejecting us, saying no at our faces, we are not going to come, we don't trust dentist, you are a student. This has been so easy to everybody. I'm sure all of dentists have gone through this, and finally get that degree, pull in a work and stand up there, and then we just get paid 6k 8k, wherein I know my engineering counterparts who know the first 4 chapters, I would have never studied the rest 4 chapters. Now, an open question, how many dentists would say this? Okay, when you're an engineer, I know engineering people come to us and say, we don't know engineering, but you can never go to a doctor who say, I don't know medicine. Per se, whatever it is, a dentist can definitely treat you for even a cold or a cough or whatever it is, and even a doctor can treat you for a dental implant also. So whatever it is, as doctors we can do, but as engineers you have such a privilege of doing everything. So half of our life is ruined. Okay, when we take up this, we don't have our me time, personal time, fun time, everything we give in. We pursue a career so seriously, giving our everything, sacrificing our even the slightest fun in our life. Then when it comes to payment, your salaries, a basic engineering degree can pay you 25k, but your basic 5-year of hardcore medical degree pays you 6k. Totally unfair, because in Indian society, quacks are entertained more than professional dentists. People around Shivajinagar will earn more than us. That's how they say. So there'll be a day when you people will actually have dentistry around 4 talo, and I don't know what is that called in English, but then your hand cart, and that's how you move. And you will move around the streets. That day is going to come. When dentists go door by door scanning teeth, I think that day has come. People's perception is coming true because of the whole stigma that's across dentists. They don't do much. But unfortunately, people should grow up and see that dentists are the most highly paid professions everywhere across the world, apart from India alone. So this whole perspective have to change. People have to trust a degree that they put in so much of effort, and they should trust by their medications, and also understand that each patient is unique. Something that goes well with that person may not be good to you. And also, not only for being a dentist but also a doctor, please don't beat them up end of the day if they don't happen to do something to you that according to you is right. Please understand they have done something definitely that according to them is right, and on the longer run according to you it will also be right.
So, what do you think went wrong, and how do you think you can prevent this?
I think our first mistake was the location, the space which we picked up. We didn't do a proper survey. Though we did a very little survey, that wasn't enough. We should have inquired what was the flats that were occupied in the opposite apartment. That was the first thing where we went wrong, because when there are no much people, where will the people come from? So no matter how much you do, if the location itself is a backdrop, it was huge. And then also the rent. The rent was too much. For a dentist, you should always select a rent from varying somewhere up to 15 to 20K, manageable for a month. And a lot of staff. Because the place was huge, we wanted to recruit a lot of people, so more staff. So their salaries, you definitely cannot compromise. So that was huge. And the place we saw was not near to us, where we both were put up. We saw a place where it's a combined place where it's feasible for both of us to work. So we could have actually done a place where it is convenient for either of one at least, so that the commute transport charges at least would have cut down. But again, we thought a place that is convenient for both, and we kept it very diplomatic, neither to burden her or neither to burden me. But again, that too went wrong. So there were a lot of things that went wrong, and also this general practice that we involved, that involved a lot of other doctors. So they were not into a consultation basis or nothing like that. They would only come when the patients were there. So what would happen? The patient would come, sit, and the doctor would not turn up, and the patient would get necked off. And then that came to a bad remark that physicians were not treating the people properly. So they had this perception the dentist may also do the same. So that again gave a negative review. There are a lot of things put together. I think everything that we did went wrong and backfired.
So, in future, will you plan to set up your own clinic?
Yes, I would definitely want to, because I didn't become a dentist out of compulsion. I became a dentist out of passion. And I would definitely want to pursue my passion any day, but not in a place where they're not appreciated. Definitely in a better country, I would definitely want to.
Any message to our viewers, especially those who are planning to open the new setup?
Yes, you will have to do a lot of research before you start off. Not only your experience, because as a dentist, when we finish out, we pass out our internship, I'm sure we can do a lot of tasks by ourselves. So we need not have to really rely on somebody. A few for extra procedures, if you have a good consultation list, that's fine. So basically, once you're out of the college itself, you're equipped to start up a setup. So a little more experience to gain hands-on for whatever it is required is well per se, but not necessarily so much of years. But rather than that, you can sit down and research on a good space, a good location, and your staff who prior have a dental experience is a bonus for you. So because they will know how to handle setup, and a very good dental chair, because a dental chair can resolve you 50% of your headache. So a very good dental chair. And I would definitely want people to know that if they can actually have a pool of doctors, a chain of doctors, not only dentists but also a proper network of doctors who can help them, a chain who can give them a gynae consultation for their pregnancy patients, or a neurologist who can give them an assurance of their other cases, a cardiologist for the cardiac patients, something like this. If they have a chain and then they pursue, it will be a dream come true for them.
Thank you so much, Dr. Nithya. I'm sure this video will be of great help for others.
Thank you so much, Dr. Prince. Thank you, first of all, for giving me a privilege to opening up about my failures. Not many people do this. I'm indeed privileged for sharing it up, and I hope this helps a lot of people who have no idea of how to start up a clinic to actually think and take a call on a relapse protap procedure, like how to go about it and really do well in their journey.
So, according to famous author J.K. Rowling, it is impossible to live without failing at something, unless you live so cautiously that you might have not lived at all, in which case you fail by default. So there is a lot of meaning into it. But as a dentist, how can you apply this? So yes, you might fail in your first access opening, you might fail in your obturation, you might fail in your crown preparation, but yes, in the end, you are trying. So these failures are a lesson for us. Usually, every person would like to share their success stories, their achievements, and so on. But I really appreciate Dr. Nithya for sharing her experience. And I'm sure this episode will be really helpful, especially for the ones who's plan to open their new setup and who can prevent these kind of mishaps. And in this episode, what I did learn was failure is an opportunity to begin something new intelligently. So if you like this content, please do like and subscribe this channel and do share it with your friends. And yes, please do check out the links which is given below, which is of great help. Thank you so much, guys. I'll see you in the next episode.